Hello and welcome to Contagious Conversations. I'm your host, Claire Stinson. Every episode, we'll hear from inspiring leaders and innovators who make the world healthier and safer for us all. Contagious Conversations is brought to you by the CDC Foundation, an independent nonprofit that builds partnerships to help the Centers for Disease Control and Prevention save and improve more lives. Joining me by phone today is Dr. Sue Desmond-Hellmann, a physician, scientist, and philanthropist who has devoted her career to improving the human condition. Trained as an oncologist, she spent 14 years at biotech firm Genentech, where she led the development of Avastin and Herceptin, two of the first gene-targeted therapies for cancer. Today, as CEO of the Bill and Melinda Gates Foundation, Dr. Desmond-Hellmann leads the organization's vision for a world where every person has the opportunity to live a healthy, productive life. Welcome, Sue.
Thank you. Thanks for having me.
We're excited to talk to you today. So to start, let's talk a little bit about your background. Who were the biggest influencers of your career?
Well, I would say the biggest influencers evolved over my career. I would start with my dad, who is a pharmacist and had a huge influence on how I thought about using a brain that likes math and science, because I'm like my dad that way, but using it in service of others. And every day my dad went to his drugstore and worked with folks in the community and the physicians who he talked to on the phone and helped people. And I really loved that and definitely wanted to have a life like I saw for my dad. Later, I met somebody else who reminded me a little of my dad, but had a huge influence in a very different way, and that was Dr. Holly Smith. Holly Smith was the chief of medicine at University of California, San Francisco, and like my dad, he had this way as a physician of connecting the science and the details of the work to why it mattered for people. What I loved about Holly is he had this way of using his leadership, how he communicated, his sense of humor, to bring everybody along to knowing that you were part of something special. And I really loved that. I definitely wanted to follow Holly. I found him incredibly inspiring. But one of the things that really touched me the most is I just liked how he made me feel. He made me feel like I was part of something bigger than me, something special and important and historical.
Well, that's a wonderful tribute to both of those people and sounds like wonderful influencers in your career. You are the CEO of the Bill and Melinda Gates Foundation. How did you come to lead one of the world's largest health philanthropies?
Well, it certainly wasn't in the master plan, I'll tell you that. As I mentioned, from the earliest that I can remember, I just love this sense of being part of something special and historical. And so I knew that Bill and Melinda had created the Gates Foundation, the Bill and Melinda Gates Foundation, in the year 2000. And so I was a fan of Bill and Melinda's and a fan of the foundation. The fundamental principle that the foundation's built on is all lives have equal value. And so that has a lot of resonance and meaning for me. But what was most important for me, and I actually left this kind of dream job at University of California, San Francisco, which Dr. Smith, who I mentioned earlier, was part of me going back to UCSF, and I really wasn't looking to leave. But what is so inspiring to me about Bill and Melinda and the Gates Foundation is this all lives have equal value isn't just a slogan. The Gates Foundation is absolutely passionate about using the capital we're lucky to have, the philanthropy of Bill and Melinda Gates and Warren Buffett, but contributing in meaningful ways to lifting people and really making sure that investment, that money, the philanthropy, allows people to lift themselves out of poverty. And so everyone has a chance for a happy and productive life.
It's such an important mission, and it sounds like you all embody the saying, you have to practice what you preach.
Well, it's funny because I often am kidded by people, and it's easy to tease someone like me to say, oh, it must be really tough. You've got all that money. When you were a chancellor and leading a university, you had to raise money. Now you get to give money away. I actually hear that a lot. And here's the thing that I think is probably underestimated is how much Bill and Melinda Gates Foundation uses metrics and outcomes, and we don't measure how much money we give away so much as we measure impact and collaborate on everything we do. So let me give you an example of impact, because I think it's really inspiring when people think pessimistically. We're optimists, but we're optimists for a reason. Here's a fact that I don't think people would realize. Fewer people than ever before in history are living in poverty. That's just amazing. And so when I think about giving money away, I think about investing in human capital. And I think that's actually a really wonderful way to think about it, as an investment. And in human capital is all about that potential and opportunity for a great life. And so when I think about those investments, I think about examples like in Indonesia, where they doubled how often people could use contraception, family planning. They reached nearly 60% of the ability for women to access contraception. And that allowed them to have a GDP growth of 5% per year for 2 decades. So that's a real example of an investment in something, contraception, that's a public health investment. And it translates into economic success because it's an investment in human capital. Another really good example is in Ethiopia, where many of us, when we were young, thought of Ethiopia as kind of the poster child for famine. And now Ethiopia is projected to almost eliminate extreme poverty by the year 2050. And that's specifically because they've invested in agriculture, nutrition, and health. And so for me, the wonderful thing about the mission and about the accountability and the metrics-driven foundation that Bill and Melinda have set up is you can actually make investments in my favorite thing, which is humans and human capital, and that can translate into success either measured by one person at a time or for a country.
That's such an interesting way of explaining that, and I think that's really going to resonate with our listeners, so thank you for that. What do you see as the most important value of public-private partnerships?
So I'm really glad you asked that question. And I have to say that one thing that I think is a shame is to look at the world of private industry as like having a black hat or being the bad guys. I reject that. And I'm sure for your listeners, they all know people. They might be people who work in private industry. And so here's the reason I'm excited to collaborate with private industry, even working at a not-for-profit. What I know is that some of the most exciting things in the world are happening in the private sector. And so I want to tap into the talent, the brilliance, the pace, the sense of urgency. Actually, I want to tap into the power of private industry. We could talk about HIV or tuberculosis or malaria. These are massive, long-standing problems of the world. So we need big, big solutions. And what I'm really glad to tell you is that we can use important charitable mechanisms to work with private industry to tap into what they're good at for a global good. And so one of the things that we use is some financial tools. One of those tools that's somewhat popular, and your listeners might have heard of, is called a volume guarantee. So a volume guarantee is a pretty simple tool where we use the money we have in the bank. We use that tool to collaborate with 2 private companies, Bayer and Merck, who agreed to reduce the prices of their contraceptive implants. So this is long-acting contraception. And they did that in return for us committing to a certain amount of purchase over 6 years. So we just said, we'll backstop the fact that you're going to sell at this lowered price. Up to now, more than 42 million implants have been distributed to the world's poorest countries as a result of that volume guarantee. So that's a fantastic example of so many women having access to contraception at an affordable price, and us using our risk capital to encourage companies to go to places of the world where they might not feel confident they can actually do business. So it's actually not corporate social responsibility. It's on their profit and loss statement. And so that's the kind of approach we take, so that everything we do has a charitable intent. It's all for people who might be struggling or who might have in front of them inequalities because of an inability to pay. But in using the capital that we have, we can encourage companies to go to new areas of the world. It's estimated by 2050, there'll be 2.5 billion people in sub-Saharan Africa. That's actually more than double the U.S. and Europe. So I also encourage companies to think about where their future customers are going to be. It's not that you should go to Africa because Africa is often the source of where people think about philanthropy going or not-for-profits going. Africa is an exciting place these days. And sub-Saharan Africa is an area with a lot of youth, a lot of talent, and I mentioned human capital. There's more potential for great human capital in sub-Saharan Africa than virtually any place else in the world.
The value of public-private partnerships is so important to us here at the CDC Foundation as well. So we appreciate you explaining it in that way. And now a transition to a question that is a bit on the lighter side, Sue. You do so much important work on a daily basis in your job. How do you relax and recharge?
Oh, I'm a complete sports nut. Running, walking, skiing, swimming, cycling, you name it. My only limitation on sports is that my ambition and my enthusiasm outstrips my talent. So I love to tell people that my only asset on sports is I'm always color coordinated.
We'll be right back with Dr. Sue Desmond-Hellmann. Since this is a show about contagious conversations, we want to hear from you. Each episode, we'll ask you a question. And this episode's question is, what is your favorite thing to do to recharge after a busy day? Just email us at info@cdcfoundation.org to answer. That's info@cdcfoundation.org. And if you share your thoughts with us, you'll have the chance to win some Contagious Conversations merchandise. Now back to our conversation with Sue. The Gates Foundation is open to taking risks in its philanthropy. Why is that important to you, Sue?
I would say that taking thoughtful risk has always been something that I have seen during my life as translating into making special things happen. And I use the word thoughtful risk because I think, as I mentioned, I'm a clinical scientist by background. That means I'm always doing things, no matter what roles I've had, that involve people. Humans. When you work with humans and not Erlenmeyer flasks or test tubes, the consequences of being wrong are higher. And yet, if you deal with things as serious as HIV/AIDS or cancer, if you don't take risk, the pace of progress is too slow. And so philanthropists are also reluctant to take risks, especially when it's humans. It's someone's mom or dad or child or brother or sister. But it's also, you can be embarrassed, and nobody likes to be embarrassed. You know, if you take a risk and it doesn't pay off, you have to confess that it didn't work out. One of the things I think is underestimated is the risk of big, bold collaborations. And there's two big, bold collaborations that are about 20 years old right now that I want to mention because I think these are two areas of risk-taking that a lot of people who were here at the foundation before me contributed to that I want you to know about. One is Gavi, the Global Vaccine Alliance. And so Gavi is a really special public-private government partnership that allows a collaboration where new vaccines can get to some of the most low-resource areas of the world. And the Global Vaccine Alliance over the last 20 years has meant that 700 million children have been able to be vaccinated against a variety of diseases. And basically the way that Gavi works is these vaccines are distributed all over the world at affordable costs for government and ministries of health. And that's a really special thing. Companies can see that there'll be a market for these vaccines. The governments can work with Gavi, especially when they have low capabilities and they're struggling, to make sure that their citizens are vaccinated. So literally everybody wins. And the second of these big risky collaborations that was put together is the Global Fund for HIV, TB, and malaria. The Global Fund is just an amazing thing and has saved approximately 27 million people from dying from these infectious diseases. And again, the Global Fund is an effort literally all over the world to pool funds and resources to make sure that people in low resource areas of the world have access to medicines to prevent or treat these really terrible infectious diseases that differentially affect the poor. And so I think what's interesting to me is taking risks can be taking risks on trying a new medicine. It could be taking risks to try and use a new campaign to do behavior change, or it can be risking bringing people who normally don't actually work together, governments all over the world, not-for-profit sector, the for-profit sector, in service of improving people's lives. And in many ways, I think that's some of the most inspiring work I've seen at the foundation. And it really means not just putting yourself out there, but now in 2019 and 2020, going back and asking for more money to keep driving these really key partnerships.
It goes to show that anything important in this world is worth the risk, and it's worth taking that jump and that leap of faith, and you have to put in the work. And so that's an important lesson for all of us. So your foundation's blog, The Optimist, is always interesting and has really inspiring content. What areas of global health are you most optimistic about right now?
We often talk about the big, important infectious diseases that the Global Fund focuses on, of HIV/AIDS, tuberculosis, and malaria, as if all three are very similar. But they're actually very, very different. So let me maybe put those three into perspective and then talk a little bit about why I think 2018 might have been a truly seminal year for TB, which is, I'm even surprised at hearing myself say that, because I didn't think I'd say that last year. But let me maybe start with HIV and malaria, because I think all three diseases are worth talking about. HIV/AIDS remains one of the terrible, terrible dilemmas of my life, I will say, as a physician. So I started as a physician in San Francisco. When HIV hit San Francisco, 1 year it was defined before I was an intern. And so my entire experience post-medical school was so heavily influenced by HIV that my husband, who's an HIV doctor, and I lived and worked in Uganda for 2 years, right after we joined the faculty at UC San Francisco. So for me, HIV is powerful and awful and real. And I saw in both men who have sex with men in San Francisco and then in heterosexuals in Uganda, the terrible scourge that HIV is. And it remains today, with nearly 37 million people in the world still infected with HIV/AIDS. The single most important thing the world needs for HIV is a vaccine. That hasn't changed, and we continue at the Gates Foundation and others to invest in vaccines, which are long-term solutions, while working with the tools we have to prevent and treat HIV. The story in malaria is different. Malaria, we have lots of tools, and in malaria, we keep thinking we're making it. 2 years ago in malaria, we realized that there was a flashing yellow light, and that was that the steady progress that the world had been making with bed nets and artemisinin and some new tools and things that we were bringing to the malaria battle, we slowed and stalled on malaria. Really tough to slow and stall. And so we, with many others around the world, are redoubling our efforts on malaria to have new tools, new approaches that are more regional in nature, thinking about regions of the world where we can control and get ahead of malaria again. But 2018, one of the things that was so very interesting is in tuberculosis. From a product development perspective, TB has lagged behind HIV and malaria in new tools and new approaches. And one of the reasons that TB has lagged is it's a really tough disease to study. From a clinical science standpoint, TB is hard because it's hard to diagnose tuberculosis. You need a sputum sample. It sits in the lung, so in a tough setting, having somebody get a good sputum sample, put it on a slide and look at it under the microscope. I have to say, I've mostly worked in my life in rich world settings. It's hard to do in a rich world hospital. It's really hard to do in the field. And then if you're diagnosed with TB today, even with TB that's sensitive to drugs, you have to take 3 drugs for 6 months. And you really have to take all those drugs or resistance can rapidly emerge. So tuberculosis in many ways is one of the hardest global diseases to tackle. But here's what happened last year that gives me some new optimism about TB. There were 2 publications last year in the second phase of testing that showed some optimism, gave me some optimism about TB vaccines. It is not an exaggeration to say that in 2018, something happened in tuberculosis that's not happened before, which is the suggestion that we might be able to have an active vaccine. That's big news and gives me some optimism.
Well, that's something worth being optimistic about. That sounds like there's so much opportunity there for all 3 of those diseases. So on the flip side, Sue, are you pessimistic on any issues?
Well, I'm just naturally not pessimistic.
Well, that's a good thing.
Happily.
Right.
I don't tend to think that way. But I will say that I am nervous about populism or nationalism, depending on the word that you want to use. It appears to be a trend over the last couple of years that individuals who are struggling or nations who have struggled through the big recession or challenges with employment and getting a good job, the American dream, has led to people thinking about their own country and questioning things like overseas development assistance or a global view of the world. And I just reject that. I'm sympathetic to people who are struggling in their own country and want to make sure that that gets addressed. But the one thing we found focusing on infectious diseases at the Gates Foundation, and we were reminded of this with the Ebola outbreak in 2014, and we're being reminded of it again with the threat of Ebola in DRC, is that a health threat anywhere in the world is a health threat everywhere. And so no matter who you are, having a world where people have the chance for a healthy, productive life actually lifts all of us. It's good for everyone from a health standpoint, from an economic standpoint. It's also something that I think many young people who aspire to have a life that has meaning, it's meaningful to think about the globe and to think about what's possible when everybody wins and everybody benefits from innovation. I would say not pessimistic, but it makes me nervous that people are thinking more nationalistically.
That's interesting, but you were able to make that an optimistic answer, so I appreciate that.
I warned you that I'm an optimist.
That's a good thing.
I will say, though, on the keeping me up at night, there's one more thing that also keeps me up at night that I want to mention, because you're in Atlanta and you're at the CDC Foundation, and that is people getting bad information about vaccines, what people call the anti-vax movement. Here's the thing I know. I know everyone loves their children. I know every mother, every father, every family values their young people and their babies. And so when moms or dads or families are scared about vaccination, it just makes me really sad. It makes me really sad, and it makes me worried about them and the information they're getting and how they're learning about the role and the importance of vaccines from their pediatrician and their community. And it makes me really nervous for the world. Here in Washington State, where I'm sitting talking to you now, we're having a big outbreak of measles. Measles, I talked about disease eradication. We really shouldn't have measles. The only thing more sad than a child being sick or dying of an infectious disease is dying of something that's easily preventable with a vaccine, and that would be measles. And so the bad information that people have, the worries that people have about vaccines really are one of the most wonderful modern inventions that exists on Earth. I've called them, and I really avoid exaggerating things when I talk about medicine, but they are nearly a miracle. To be able in such a safe and effective, low-cost way to prevent disease in so many people around the world is a special, meaningful thing. And it's also something you're doing not just for your child, but for your community and your school and where your child goes to school or where you go and work. And so I think all of us who care about health need to start talking to our neighbors and in our own community, make sure it's safe and comfortable if someone's scared or nervous, that they can talk about what they're worried about. And so that we can have a really healthy community dialogue about protecting all children.
Absolutely. Well said. And communication and good information cannot be understated on this topic. So such an important topic right now, especially. Back to what you were saying earlier about your work at the Gates Foundation, what would you say is your biggest challenge at the Gates Foundation?
Wow. We don't work on any easy problems.
That's true.
I would say that's the case. I'd say that the biggest challenge is when we move from trying to solve problems in what people would call a vertical way. So, I'm a product developer, and I love, as you can tell from my stories about tuberculosis, I love when I think we can solve a problem by making a vaccine. I love when I think we can solve a problem by making a remedy, because we know how to do that. We do know how to do that. We know how to look at targets. We've figured out some novel ways of funding that. There's well-established systems across the world, whether they're in private industry or academia or in government, about how you make new products available for health. Here's what we don't know how to do in the world as easily. It's change systems. So the biggest challenge that we have and others have is, what if you're trying to change the system by which we deliver healthcare? What if you're trying to change the system by which education is delivered? Changing health systems, changing educational systems involves a lot more local community input, involvement, and frankly, differences of opinion. And so how a foundation like Bill and Melinda Gates Foundation participates in that dialogue and in that systems change work, I would say is a work in progress. We had a great experience in the last couple of years working with government of Ethiopia. With government of Ethiopia, we were working in very much disease-oriented ways, malaria, tuberculosis, working on things like pneumonia and diarrheal disease. A couple of years ago, government of Ethiopia came to Gates Foundation and many others and said, look, we want to drive a health systems transformation for Ethiopia. They had watched Rwanda and what Rwanda had done in health systems transformation, and they had really pushed themselves to get ahead of a very disease-oriented way of thinking about health. And it's been a wonderful learning experience for us and a terrific collaboration with Bill and Melinda Gates Foundation and government of Ethiopia to really transform how we work together and look at, can government of Ethiopia change their health delivery system, and can we be supportive and partner with them in that when the drive in the direction comes from government of Ethiopia, and we take our vertical aspirations, which haven't gone away. We still want to work together with government of Ethiopia on pneumonia and diarrheal disease, but thinking about how the health system transformation and about the 2030 goal of universal health care and changing primary health care. And so I think that is an aspiration and a direction that's both positive, but really, really challenging work to do. Some of the hardest work we're working on right now.
Absolutely. And I would say and agree that you do seem like an optimistic person. So next question, you will probably like more. What is your biggest opportunity?
I think the biggest opportunity is something that I do think I may have in overabundance, but I actually think the world needs a little more of it. Part of the reason I think I'm optimistic is I like feeling energetic. I'm not big on pity. I'm not a good patient. I will confess to that, because I don't like needing help. I like helping, and that I like doing. The Bill and Melinda Gates Foundation's optimism is not driven for no good reason. It's informed optimism. And I think, especially for young people today, the thing I'm optimistic about and the thing I'd love to tap into even more at Gates Foundation is the sense that it is possible for anyone around the world to make a difference.
I think we can all learn something from you, Sue. And I love the idea of informed optimism. I think that's the perfect way of explaining what you're talking about here. So I love that. Now, a really important question that I'm most excited to ask you about today. What advice do you have for others, especially women, who want to become CEOs and innovators like you?
You sound like my brothers and sisters and my in-laws who are always saying, talk to Aunt Sue.
That's great.
So I'll put on my Aunt Sue hat. I have to say I come at being asked for advice with a lot of humility. I am so lucky to have had the opportunities I've had. So for me, some of the best advice that I've been given is to keep learning. It's kind of popular to say to be a lifelong learner, and I think that sounds really trite. But I will tell you that there's been a couple of times in my career when I've been in roles or jobs where I just think this might not be the right place for me or the right job for me, or I'll feel anxious or uncomfortable. And happily, the advice I've been given and my own instinct is, well, if I just learn more, if I just, reach out to people and say, what should I read? Or is there a paper on that or a book I can read? I'll be more comfortable, less anxious, and maybe this will work out, or if it doesn't work out, I'll learn something. And so that's always been a huge asset for me, because two good things happen as a result of that. The first good thing is that I reach out to other people and ask for help, and it's a tremendous sign of respect if I'm learning from other people. Everybody likes to know that somebody wants to know what's in your brain, and so I think we all underestimate what a wonderful gift it is for a colleague to ask you to help them get smarter. So that's something that I always remind myself of, because it feels good if somebody asks me that way. And the second thing is, even if you've had one of those years where you say, this probably wasn't my best career year, but you took the time during that year to learn something new, boy, that's an asset. And so I'd say that advice number one is learn. No matter what, learn a lot. The second thing is be willing to take risks, even if it's not clear that risk is good for your career. I have joked about the best advice I didn't take was moving to Uganda and ending my academic career, which is actually true, but it was a good comeback, so it worked out all right. But for me, moving to Uganda before there was a global health infrastructure and really not publishing and not doing the kinds of things you need to do to stay on the academic ladder was the best thing I did. And it changed me as a person. It changed the way I thought about life, and it made me more grateful. And I learned so much from the Ugandans who I was fortunate to work with. I would do that over again in a heartbeat. And yet, if you plotted out a career path to professor, boy, there was a lot of zigging and zagging that had to happen after that for me to be a professor. It's not over-indexing on whatever ladder you're on, but maybe over-indexing on what you'll learn.
That's a really good, solid piece of advice. I think we all wish we had an Aunt Sue like you. What would you say is the defining point in your career?
Oh, I hope it hasn't happened yet.
Still to come? Pending. No, I'm kidding. But I'm only half kidding. The one moment of my life as a grown-up that I often look to as a place where I just literally kind of closed my eyes and said, I want to remember this moment, was the day that the drug Herceptin was approved. So like so many women in America, my family's been affected by breast cancer. And one of my sisters and my mom have both had breast cancer. And, having been a practicing oncologist and loving science and getting to participate at Genentech in the development of Herceptin, it just felt to me like I was so grateful to have the chance to be part of that effort. And it was so hard. And so many times I didn't think it would happen. So that moment and getting to be a part of it and getting to be on the front lines and experiencing that just felt to me so special and so important. And I would remember the history of medicine and that moment in time and that I got to be part of it. So I would say of so many wonderful things I've gotten to participate in, that made a huge impact on me. That's very powerful and inspiring. Thank you for sharing that. Thank you so much for sharing your story with us today, Sue. You have had a profound influence on global health. And on behalf of the entire CDC Foundation, we want to thank you for your partnership over the years.
Back at you. We, as you know, at Bill Melinda Gates Foundation, are big fans of CDC and CDC Foundation. So I've been happy to have this conversation with you today. Thanks a lot for all your great questions.
Thanks for listening to Contagious Conversations, produced by the CDC Foundation and available wherever you get your podcasts. Be sure to visit cdcfoundation.org/conversations for show notes and bonus content. And if you like what you just heard, please pass it along to your colleagues and friends, rate the show, leave a review, and tell others. It helps us get the word out. Thanks again for tuning in, and join us next time for another episode of Contagious Conversations.